regarding doon sa consulta package, if I may ask lang, Doktora Shirley, or whoever is in charge on the implementation, there is 500 pesos per capita, no, na binabayaran nyo doon sa accredited facilities. Is that enough? Based on your computation? Anyone from PhilHealth?
Mr. Chair, may I
Yes,
call on, yeah, that is based on a costing methodology, but may I call on Doktora Herrera to be able to give you the details of this.
Okay, Doktora Herrera.
Morning, Madam Chair, if I may po. Yes, it is costed based on a ratio of one doctor per 10,000 individuals po. And in the context of capitation, if the members or the members in the catchment area are kept healthy, they pull the 500 pesos per head, and only the sick will be using up the fund that is allocated to the healthcare provider. So kung kukonti lang po yung may sakit, kukonti lang po mag-iisa po nung fund na naka-allot sa healthcare provider.
Yeah. Doktora Herrera, kasi it's parang kind of the same doon sa expanded primary care benefit. Ang problem nyo at 500 per capita, yung professional fee is not included. So you ask the facilities, accredited facility to give appropriate amount, no, from that 500 pesos. So ang feedback ng mga health facilities, wala silang makuha na doctors who will participate in the program. And maybe that's the reason why currently very few ang nag-participate sa inyong program on consulta package. So how are we going to address that, no? Yung problem natin with professional fee at this time ba meron pang nababayaran ng 100 pesos na doktor? Out of 400 kasi meron kayong mga lists of diagnostic exams included in the consulta package.
Thank you po, Madam Chair, for that question. We will be reviewing the package by the end of the year, and we will see po if there will be a need for adjustment. But at this time po, we are collecting baseline information that we can use to enhance the package later, ma'am.
Okay, thank you, Dr. Riza Herrera. Again, no, I will raise my concern on that program. Yung when I asked you before, paano tayo makapag-encourage ng ating facilities to participate kasi na-defeat yung purpose. Supposed to be all Filipinos should have an access to a comprehensive outpatient benefit, and based on the law, you were given 2 years actually to implement that. And hindi ko makita kung magiging successful yung inyong consulta package. So kung pwede sana before kayo mag-implement ay pag-aralan mabuti, no? Yung costing number 1, ang consideration natin hindi siya natatapos sa accreditation of facilities. You need partners, doctors who will check on the patients or who will take care of the patients. So very important po yun, Doktora Herrera.
Yes, Madam Chair, your concerns are well noted.
Okay, thank you. I'd like to call on our first interpellator, Representative Stella Kimbo. You have the floor.
Salamat, Madam Chair, and good morning sa lahat. Madam Chair, maganda yung pagtatanong nyo kanina, but I wasn't very satisfied dun sa sagot doon sa ilan ba ang covered ng PhilHealth. Kasi alam natin, ayon sa batas, the assumption is 100% ang coverage kasi may automatic membership. But I think ang tanong ninyo is, ilan ba ang registered na members and dependents among the 109 million? So yun ang first follow-up question po.
PhilHealth. Anyone from PhilHealth?
In short po, ilan ang listado na pangalan na members and dependents?
Madam Chair, pwede ko pong sagutin.
Yes, Sir Linguel, go ahead.
Yes, good morning. Thank you po for the question, Congresswoman. Hi, good morning po. Yes po, apparent po sa database namin, meron naka-register na 95 million. But right now po, we are revisiting how we extracted or we generated the numbers. Kasi po, as we know po, do sa population coverage po sa Section 5 ng Universal Healthcare, all Filipino citizens should be registered. And we are currently revisiting our database po on how we generated that number. And yun po ngayon, at the same time po, yung initiative namin na maging mataas po yung data integrity po ng aming member, yung start po ay yung we sought there is now a data sharing agreement with PSA on the death registry. Kasi po apparently it's not the behavior of Filipinos to report death in their family, lalo po sa implementation of NHIP kasi wala naman pong benefits, hindi ko kagaya ng mga pension funds kagaya ng SSS at GSIS or Pag-ibig na meron pong benepisyo pag ni-report nila po yung kanilang death in the family. And the second po na to clean up our database ay plano rin po namin i-collaborate or there will be a program collaboration with the implementation of the Philippine ID system. So para po lahat ng database namin nakalink up doon sa PSA. And then yung may third pong initiative ginagawa namin, may mga certain data inaccuracies since the start of the program po kami nakikita. And we are starting to look on it and to find out bakit po may mga special characters, invalid date of birth po nakalagay sa database namin. So
Sir Linguel, so the answer is currently you don't have that.
Yeah po.
Yes.
Yeah
Okay.
po.
Sige, okay na yon. Okay na yon.
Yeah.
Okay,
So nung tinanong ni Madam Chair kung ilan ang subsidized at sumagot si Secretary Duque na 87%, what he was actually referring to is number of registered. So ang follow-up question is ilan ang subsidized?
Right now po yung proposal namin sa 71 billion fund for this year is about 22 million Filipinos po yung members. So yun po yung subsidized po sa population.
So including dependents, ilan yun?
Roughly po mga aabot po ng mga 50 plus po, no? Kasi hindi
Okay. So
yun din po.
sige, doon sa 50 plus million Filipinos na isusubsidize ng gobyerno, ilan po dyan ang listado?
Right now po, yung current sa database namin na sinisingil po sa DBM, ayun po ay lahat listado. Ibig sabihin po listado, merong PhilHealth identification number.
Okay, so alam nila lahat?
Opo.
Alright, okay.
First.
O sige. Next question. Yung consulta coverage, so 30,000 ang covered right now. 30,000 divided by 109 million is 0.027%. So that is the coverage rate of your consulta package, which is a very dismal number considering that the law provides that every Filipino must be registered to any public or private primary care provider. So sa loob-loob ko nga parang hindi ba kayo nahiya na ni-report niyo yung 0.027% na coverage? And meron 118 providers accredited. So lumalabas, one doctor will take care of 254 patients. Since 109 million tayo, i-divide mo lang, no? Kailangan mo ng 429,000 primary care providers. So maraming tanong dyan, di ba? How do you scale up your consulta program to get 429,000 primary care providers? Ilan ba sila? And nung nag-report po kayo sa committee na to tungkol sa pagbayad sa healthcare workers, nagbayad lang kayo ng 379,000 healthcare workers. lahat na yun na nasa frontline. So paano ninyo gagawin na kukuha ng 429,000 primary care providers para magkaroon ng bawat Pilipino ng isang primary care provider? Sana please shed some light on ano ang balak ninyo sa pag-scale up nitong konsulta package.
Doktora Shirley or anyone from PhilHealth who's in charge of the consulta?
Yes, may I do an initial answer to that, Madam Chair? First of all, the ratio that we envision for a primary care provider to the population is 1:20,000. And therefore, we need 5,500 healthcare providers for the consulta. The numbers that we gave was an initial number for the, it was implemented early this year in pilot sites. Actually, there's another pilot site that was also implemented in Sorsogon, and there were around 600,000 registered in Sorsogon, which we are still validating. The list we're still validating. Maybe Sir Lemuel can be able to talk about that validation. But we are going to offer it nationwide. Just now, we are still at the stage of asking for providers for this program. So nandun na kami, we're putting out ads and doing IAC for providers to be able to join this program para lumawak muna yung ating providers before telling the people about this and registering it to this program.
So, Doc Shirley, itong 118 providers, alam po ng bawat isa sa kanila na ang expectation is that each one of them will handle 20,000 individuals.
Yes.
Alam nila yun.
Yes,
They've already set aside the time in their practice to see 20,000 patients under consulta package for 1 year.
That's the design of the program, ma'am. And I believe
know
an
that.
orientation was done in these different LGUs at the time it was implemented.
Sa tingin mo, ikaw ay isang doktor, kaya mo to take care of 20,000 individuals? So ilan yon kada araw?
Well, ma'am, the idea is not for them to look at each patient face to face at all time. No, even the diagnostics is not to be offered. Yung lahat yon pupunta sa isang patient. It's evidence based, and therefore they're not going to implement diagnostics for all these 20,000 individuals.
Yeah,
So,
but I think it has to be reviewed because that means seeing 55 patients only for PhilHealth. Kasi your doctors would have other things to do, right? So ibig sabihin kung sumama siya sa consulta package, this doctor sets aside a certain portion of his or her day to see PhilHealth patients. And that's about 55 per day. And I think that's way too much. Kawawa naman ng doktor, di ba? So sana po ma-review natin for a more realistic planning and rollout of consulta. I would like next to go to the financial condition of PhilHealth. Pwede po bang malaman ang net income po ng PhilHealth last year, 2020?
Good morning, Sir
Morning.
Congressman Tiamao. Yes po, good morning to all. I am Attorney Emily Roque, the Acting Senior Vice President of PhilHealth, currently occupying the position. Ma'am, for the net income of PhilHealth as of December 2020, we have 30.1 billion income. Then
Okay.
we have
Pwede pong i-breakdown just collections, investment
Okay, ma'am.
income, at magkano ang benefit payments?
Okay, ma'am. For the premium contribution, we have around 149 billion as income, less the benefit expense that we incurred, around 120.9 billion. Gross income of 28.1 billion, less the operating expense of PhilHealth of 7.1 billion, net operating income of 20.9 billion, and the interest and other income from investments, we have 9.1 billion, madam. So total of net income for December 2020 of 30.1 billion.
And magkano yung reserve funds as of December 2020?
Ma'am, for the reserve fund, given the recognition of PhilHealth for the year 2020, as directed by the Department of Finance of the insurance contract liability, we incur actually, ma'am, a negative, negative members' equity for the year December 2020 of
No, I'm
around
asking for the reserve fund balance. Yung balance po on December 20. December 2020.
Attorney Roque, or Ma'am Shirley, I think she's mentioning you have like 100 plus. Can you be at least specific? How much is your
Yes.
reserve fund? Doktora Shirley, you mentioned in the interview, I heard it, that you have more than 100 billions of reserve fund. Anyone from PhilHealth?
Memorize niyo dapat po
Ma'am?
yan.
sorry, ma'am. The reserve fund is 140 billion, ma'am.
Okay, so buhay na buhay pa po ang PhilHealth. Taliwas po sa sinasabi ninyo last year na mamamatay na ang PhilHealth. Tama po?
Yes, ma'am.
Okay.
Opo.
And last year, tandang-tanda ko at I was very concerned with your actuarial projections because you said in various hearings, including during the plenary debates, that you expect a deficit, a net loss of 86 billion pesos for 2020. Ang nangyari po ngayon, kumita kayo, 30.1 billion. So congratulations, kumita kayo. Anong dahilan? Ano nangyari? Bakit? Why raise all the alarm bells last year that you were going to die soon and that you would incur a loss of 86 billion? Only to find out that, you can actually do a good job of generating an income for all our members, like you've always done in the past. Ano pong nangyari doon? Pwede niyo bang ikwento?
Kong Stella, last two questions, please.
Opo. So, that's my second to the last po. After that, another one po kung pwede.
Yes.
Ma'am Neri, go ahead.
Yes, Madam Chair. Thank you, Madam Chair. Thank you, Congresswoman Stella. Yung pong projections last year was based on initially there was an offering of the consultant in 2020, which did not materialize in 2020 because of the pandemic, and also there were in the early part of 2020 we have expected the high payout in terms of benefit payouts for the COVID. But basically, the projections were based on the consulta being implemented starting in 2020 in response to the UHC Act, Madam Chair, Kong Kimbon.
Siguro, Madam Chair, para mas maintindihan natin, kung pwede isubmit po yung actuarial projections sa atin lahat. And Madam Chair, can you just kindly note that I've been requesting these projections for weeks now. At hindi pa po ako sinasagot, unlike last year na napakabilis ng response. So kung sana pwedeng isubmit po. Finally po, my last question is for USECMAR. Ngayon po na meron na po tayong Mandanas-Garcia ruling, will that somehow help us with the financing for primary care? Kasi alam ko we had this discussion before and sinasabi po ninyo na ang konsulta package ayon sa batas should be financed out of PhilHealth. So ang tanong ko is bakit ba natin pinagpipilitan na PhilHealth ang mag-finance ng konsulta package when in fact we know it's not insurable? It doesn't make sense to take out something that is a certain expenditure sa isang insurance fund because that's not how insurance funds work. And if you read the law, it just simply says that the financing for individual-based health services should be prospective, such as social health insurance. So ngayon na may Mandanas ruling at dumagdag ang budgets ng ating LGUs, sa tingin niyo po ba posibleng gamitin ang budget, dagdag na budget ng LGUs para po tulong sa pag-finance ng primary care? And siguro, last question na lang, anyway, related naman, is ano po yung comment niyo, USECMAR, dito sa recent na nangyayari na meron tayong kakulangan sa pagbayad ng ating healthcare workers, resulting in a threat to walk out of the front line. And at the same time, meron na namang suspension ng pagbayad ng claims sa hospitals, again, resulting in a threat of hospitals to disengage from PhilHealth. Hindi po ba ang layunin ng universal healthcare is to ensure access to healthcare? Ang nangyayari ngayon, kung kailangan natin ng access to healthcare dahil may pandemic, tila ang lumalabas na polisiya mula sa department at mula sa PhilHealth ay parang nagre-result in the opposite effect, which is kumukonti po ang ating supply side. So kayo po bilang ama ng universal healthcare sa banda ng DOH, ano po ang comment ninyo po?
Yusek Mario Villanueva.
Yes, Kong Stella. Kung i-consider po natin yung Mandanas-Garcia ruling, there is an estimate by the DBM that the IRA increase will be around 27%. From the figures that I have here, this is around 234 billion pesos increase in the IRA for 2022. And we believe that, since this will be released as parang general fund, we are not very sure if the LGUs will really put this into health investment, no? So this will again depend on the priorities of the local government units. We are actually advocating that a certain portion of this should be geared towards the health investment at the local level. And I think that there is a pending bill filed, I think, in the Committee on Health by your chair to really fix this, no? Kasi ang nakikita namin, kung hindi rin ipaprioritize ng specific LGU yung health, then this sort of additional funding coming from the IRA ay baka hindi rin malagay yung a portion of this at least for health investment. But with that, no, if this really will be prioritized ng ating local government units, the best actually is to invest this first to upgrade their capacity, yung supply side, Kong Stella, kasi kulang pa rin yun, na-mention ninyo rin kanina, yung one doctor to 10,000 at saka yung one health center or provider, primary provider for every 20,000, baka kailangang i-improve din ng LGU to invest in more health centers and employment of new personnel, doctors and nurses and midwives at the very least, no, para gamitin itong pera na to. So I think more of upgrading and updating their capacity, yun yung kailangan munang mag-invest ang LGU with the additional funds that they will get from the IRA. Yun lang
Thank
po.
you. Thank you, Yusek.
Yun, alam po yung,
Stella.
sorry po yung question ko po on yung comment niyo dito sa nangyayaring mga policies ng DOH at PhilHealth na parang taliwas sa layunin ng universal healthcare.
Madam Chair, if I may be allowed to answer this. Yung pong naibigay na po natin, I think, I'm just double check ko lang itong amin mga naibigay na. Pero ang inireklamo sa ngayon ng karamihan ng ating private healthcare workers, about 20,156, no? Meron po tayong na-identify na, which we will get according to DBM USEC Tinakanda from the Miscellaneous Personal Benefit Fund. Ilalabas ito, 311 million. So within the day. So hopefully by tomorrow, we can start implementing this, Madam Chair. And then for our continuation of our contracts of healthcare workers from September to December, that will require a funding of about 3.6 billion. So, na-identify na rin po namin ito with the guidance of the DBM, yung 1.9 billion kukunin sa contingency fund ni Pangulo, dahil ito po yung malinaw na kautusan ni Pangulo, and the 1.5 million na hindi pa nagagamit ng DOH. So, i-consolidate itong mga funding na ito. So, we will be able to continue the
Sec Duque.
20,000 plus. Yes.
Okay, thank you, Sec. If you can furnish lang the committee on yung copy of the actions to this problem on the SRA, ha? Kung ano po yung naging actions nyo, just provide us yung copy po noon.
Yes,
Okay,
we'll do.
thank you so much po.
And the budgetary requirement that has been identified. Yes, ma'am.
Okay, thank you so much. Thank you,
Salamat
Kong
po.
Stella.
Salamat po.
Would like to direct PhilHealth to please provide Kong Stella also this committee on the documents she's been asking from you immediately. If you can do it this afternoon or tomorrow, please provide Kong Stella and this committee. I would like to remind our colleagues that we need to strictly follow the 5 minutes interpellation because we have another agenda, which is the PhilHealth Circular. I would like to call on Representative Ging Swansing.
Thank you, Madam Chair. In the interest of time, kasi dalawa tayo mag-defend sa plenary mamaya, I will reserve my questions na lang dun sa Circular 2021-0013. So I would like to yield my time to the other members who wants to ask question.
Thank you, Kong Ging. Next, I would like to call on, I think, Tita Kong Marilu also yield her time. I would like to call on Kong Jun Gato. Kong Jun?
Thank you, Madam Chair.
Yeah, question should be on UHC, please.
Thank you, Madam Chair. In the presentation of Yusek Villaverde, regarding the redevolution of health services under the Mandanas Garcia case, my concern is the provincial hospitals under the Department of Health. Will all provincial hospitals under the Department of Health be devolutionized? Made-devolve ba lahat ang mga provincial hospitals under the Department of Health? Maybe Yusek Villaverde.
Yusek Mario?
Yes, opo. Actually, nung pa pong Local Government Code of 1991, lahat ng provincial, district, municipal or city hospitals have been devolved to the local government units. What has been retained by the Department of Health are the regional medical centers and the national hospitals that we have right now, no? Now, when it comes po to the development from the Local Government Code from 1991 up to this time, mayroon pong ilan ng mga provincial hospital na nire-nationalize, no? And this has been included already in the budget of the Department of Health. So, yung pong mga nire-nationalize at covered na ng batas, hindi po kasama yon doon sa tinatawag nating redevolution. Yun lang pong mga talagang nasa mandato ng ng ating provincial government, which are generally the provincial hospital and the district hospitals. Tapos po yung mga highly urbanized, yung minemaintain nila ngayon na city hospitals, sa kanila pa rin po yun.
Yusek Mario, interject lang ako kung Jun Gato. Diba you were asked to identify which of the programs will be devolved, no? Based on yung mga national programs ninyo. Diba meron tayong kinreate na Committee on Devolution? Yusek Mario? Yusek?
Yes po, this is an interagency committee composed of several agencies at mayroon na pong draft na redevolution plan ang Department of Health, which are now undergoing some consultation and comments by our LGUs as well as our regional offices.
Okay,
The
Yusek
deadline po for
Mario.
submitting this consolidated redevolution plan of the on health will be the last week of September, but we plan to have it much earlier para makita na rin ng ating mga partner LGUs.
Okay, Yusek Mario, if you can provide the committee once finalized that programs that will be revolutionized, no? Go ahead, Kong Jun Gato.
Yes, thank you, Madam Chair. I'm glad to hear that, Yusek Villaverde, because our provincial hospital, yes, it's true, na-devolutionized siya noong 1980s when the local government code was implemented. However, few years after, because our province cannot maintain the hospital, it was renationalized. So my concern was in the implementation of the Mandanas Garcia case, baka naman babalik na naman sa ma-devolutionize naman. Mahihirapan na naman kami sa probinsya namin sa Batanes. Thank you, Madam Chair. And thank you,
Kong Jun.
Yusek
Thank you so
Villaverde.
much. Thank you. Next to ask question is Representative Caloy Zarate. Kong Caloy.
Thank you, Madam Chair. Good morning. May I proceed now, Madam Chair?
Yes, Kong. Please proceed.
First comment lang siguro, I think it is a misnomer to call the implementation of the Mandanas ruling, especially when it affects hospitals, as to revolutionize, no? Because it may send a wrong signal, Madam Chair, that all the other hospitals who are now renationalized will also be devolved, no? So yun siguro kailan mabuti at nilinaw yun, no, na in fact sa amin panawagan nga namin na lahat na binitawan noon ng mga hospital na subject to devolution will be renationalized, no, given the history now of those devolved hospitals na talaga napabayaan, Madam Chair, no? So that's one point that I want to raise. Now, Madam Chair, just a starter, may we know from PhilHealth or from the DOH how much is the budget that they requested for PhilHealth for 2022?
Secretary Duque.
Because I still fail to scrutinize all the details nung sinubmit na budget kahapon. But just for the record.
For the record, Madam Chair, the PhilHealth budget, we asked for 110 billion point 13. But SNAP reflects 80 billion, Your Honor.
80 billion, ito po yung subsidy natin doon sa premium that will cover doon sa universal healthcare. Tama po ba yun, Madam Chair?
Tama po yun. Essentially, Madam Chair, that is correct.
Yes, thank you for that reply, Mr. Secretary. No? Last year, it's 70 plus. Now, it's 80 billion. But again, siguro after so much discussion natin dito, there is still so much question. Many questions about the implementation of the universal health care. No? In fact, there is a parang may opinion that yung universal access to healthcare is now becoming a fallacy. No? Especially in itong nangyayari ngayon na we are overwhelmed by this crisis aggravated by this COVID-19 pandemic. No? Parang nasa almost mag-collapse na ang ating, if not all, no, ating healthcare system. Yesterday we recorded more than 18,000 cases, no, and as experienced by not a few but many, of course hindi lang naman kasi Madam Chair, hindi lang naman ang mga sakit ngayon ay related to COVID, no. There are also other cases na hindi na ma-accommodate ng ating healthcare system, and they are forced in fact to go to more expensive hospitals kasi yung ating public healthcare system ay overwhelmed na, no? So and when they go to private hospitals, to their horror, very limited lang yung magiging coverage, no? So hindi, it's a fallacy na yung wala ka nang babayaran pag you're enrolled to PhilHealth. Hindi ganoon ang realidad, no? And in fact, ito yung hesitancy na nga ng marami ngayon, Madam Chair, na hindi na rin pupunta sa mga ospital, no? And namamatay na lang sa kanilang mga bahay-bahay. So yun yung isang point na gusto kong erase, and we hope to get a reply from our resource persons dahil hindi natin alam, Madam Chair, kailan pa matatapos itong COVID-19 given the record that we have now. No? Instead of going down, the cases are going up, no? And we are threatened with other so-called variants. Tapos on the other hand, hindi pa naman din ganun kabilis yung ating vaccination rollout, kulang yung mass testing, yung contact tracing problematic. Now, treatment is a big problem. So may we get a reply from our resource persons, Madam Chair?
Secretary Duque.
Yes, Madam Chair. The universal healthcare law is very clear, and this has to be enforced, that the private hospital beds, of which account for about 60,882 throughout the country, 10% of that should be as service beds, no, for our indigents, for those who cannot afford. And under the law, that has to be covered by PhilHealth under a no balance billing policy. Now you add up that 10%, which is about 6,882, to the 49,254 naman ng ating public facilities, public beds. No? So that's a good about 55,000 beds all in all. So we are improving. I believe PhilHealth can confirm the implementation of the no balance billing is much higher now than it was ever before. But I don't have the exact figure if it is already more than 90% ang implementation ng no balance billing. But for the information, Madam Chair, the Department of Health, together with the local government units, continues to expand our healthcare system's capacity. And that is ongoing. And in fact, I'll give you an example. The ICU beds now, just at the beginning of the year, was about 700 lang in NCR. I'm just talking about NCR. But now we're about 1,300, 300 plus, no? So there's progress in terms of the expansion of our limited health systems capacity, both in the area of temporary treatment and monitoring facilities, yung mga isolation and quarantine facilities, and then also for the level 1, 2, and 3, as well as the Apex hospitals. So doon naman sa testing, from the one laboratory that was capable of doing RT-PCR tests, we're now, I think, about 260, 270 testing laboratories, both public and private, distributed across the country. So our TTMF beds would total about 135,000 beds, Your Honor, Madam Chair. So tuloy-tuloy po ang ating pagpapaunlad ng mga kapasidad, at hindi po madali dahil nga habang nagpapalawig tayo ng ating mga kapasidad, minsan yung mga tao natin, halimbawa sa DPWH, yung paggawa ng mga modular hospitals, tuloy-tuloy din po yan, pero minsan naapektuhan din pagka nagkakasakit o nag-COVID, mag-isolate, magka-quarantine. So medyo may mga pag-antala sa kagustuhan natin na talagang mas mabilis pa na mapalawig o mapaunlad ang ating health systems capacity. Maraming
you,
salamat po.
Secretary Duque. Thank you, Secretary Duque. Kong Kaloy?
Yeah, thank you, Madam Chair. Okay naman yung nilatag ni Secretary Duque na improvement, no? But again, Madam Chair, napakalaki ng hahabulin natin, ano? At ito yung problema kasi yung ating universal healthcare talaga nakaasa yan doon sa insurance, no? Sa premium sa health, sa PhilHealth. When in fact, ang ating ang panawagan doon, yung pondo na limitado natin ay dapat talagang direkta ng ilagak doon sa mga pampublikong mga ospital para direktang ma-access na rin ng ating kababayan. For example, Madam Chair, this has been the trend ever since, no? Ito na yung last term ko sa Congress at hindi nagbago itong trend na ito. Taon-taon, tinatapisan talaga, binabawasan yung pondo para sana sa mga pampublikong ospital, no? And in fact, if a quick look at the budget for next year, well, we have a 1.18 trillion budget for infrastructure. The budget for health infrastructure is, in fact, barely 1% of that 1.18 trillion. So how can you expect? Okay, meron kang 135,000 beds now, but the cases are rising. Ang dami nagkakasakit, no? Hindi lang COVID. At hindi na ito ma-accommodate ng ating public healthcare system. Much more probably by the private healthcare system with the problem we have now with PhilHealth, no? Na hindi sila babayaran. So again, Madam Chair, I think from this representation, there is really a need after this hearing that we have to revisit, no? This universal healthcare, because actually it's not universal really, in the sense that hindi pa rin ito na-access ng ating mga mamamayan dahil sa limitation nga nung i-cover lang ng insurance, no? So that's a point that I want to raise, and probably in the coming days during the budget, no? Dahil talagang tagibang, bawas na naman yung mga budget ng mga pampublikong ospital, no? Binawasan na naman. So and finally, Madam Chair, dahil meron pa namang another round dun sa another item natin. Doon lang sa, even doon sa usapin ng kanina, no, nung malaki pa rin pala, malaki naman pala talaga ang pondo ng PhilHealth, no? And contrary doon sa picture na they painted last year, that even our overseas Filipinos are up in arms, we're up in arms dahil sila rin ay piliting mag-contribute doon sa PhilHealth at mabuti na lang at isinantabi muna ito, no? So along this line, nabanggit ito ni Yusek Mario kanina, no? They have this redevolution plan in relation to Mandanas. Siguro i-require na lang natin sila, Madam Chair, no, to submit to this committee as well as this representation that the particular plan, what is really that particular plan, no? Because a lot are also anticipating how this Mandanas ruling will affect, no, everything, no, from health to all the other aspects na pwedeng maapektuhan nito in the implementation of programs. So final point, Madam Chair, doon sa program naman na nabanggit, konsulta, talaga I'm supporting the observation of Representative Stella Kimbo, no? Siguro they have to revisit and pag-aralan ulit ito dahil napaka unrealistic. Can you imagine for the next 24 hours, theoretically, a doctor has to take on two patients, no? Dahil doon sa sinet nila na guidelines na 120,000 a year. Sabi nga ni si Constella kanina, 55 patients in a day. So that 55 patients, wala ka ng tulog-tulog, kailangan matapos mo doon yung 2 pasyente, no, na magkakaroon ka theoretically ng consultation. So I think this is not realistic given the problems we face now dito nga sa aggravation itong COVID-19 pandemic, Madam Chair. So thank you, Madam Chair. If we get a response from DOH and PhilHealth to those points I raised.
Secretary Duque, brief answer, and then from PhilHealth. Anyone from DOH?
Kindly recognize, Madam Chair, Yusek Villaverde.
Yusek Mario.
Yes, thank you, Madam Chair. Doon po sa isang sa comment ni Kong Zarate, pwede po naming mabigyan siya ng kopya o ang committee nung aming proposed plan for the implementation of the Mandanas Garcia court ruling. And then second po, yung sinasabi kanina related doon sa PhilHealth estimate, kung ang pagbabasihan po naman ay ang ating health center, primary care provider, no, nung ating mga konsulta package, at saka yung iba pang mga outpatient benefit package ng PhilHealth. Sa function po kasi ng health center, it is actually a team effort. Although alam natin na medyo mabigat na yung 1:20,000 na population ratio, no? Pero team effort po naman yon. Hindi lahat ay kailangan na nakikita ng mismong doktor. Like for example, yung mga prenatal check-up, usually yung midwife naman ang medyo tumitingin noon at nire-repair kung nakikita niyang may potential na problema ang pasyente doon sa health center physician. Or kung let us say po mga check-up lang ng blood pressure, may mga nurses na nagtatrabaho po sa health center. So it's actually a team effort. But we know and we are aware na medyo na nga po yun. Kaya kanina nabanggit ko rin na very critical na ang local government units with the additional funds that they will get from this Mandanas Garcia ruling should really invest in the improving the supply side capacity, which means creation of new positions for doctors, nurses, and midwives sa ating mga health center, as well as development ng mga additional health centers and mga barangay health station para po mas malakas ang ating primary care level of health services. So yun lang po, and maraming salamat po.
Anyone from PhilHealth? BP Shirley Domingo?
Yes, ma'am. I would just like to confirm yung sinabi ni Yusek Mario, yung design po ng konsulta is risk-based, evidence-based, so hindi po lahat ng assigned to the provider ay magpapatingin or even will undergo the diagnostics po because it's risk-based. Pero tama po kayo, although we did really costing methods in coming out with amount, and we also had consultations with providers. I was part of one of that provider consultation, and the providers accepted the amount. But tama po kayo, we will review as a requested consulta package.
Thank you, Doktora Shirley Domingo. Last to ask question on this topic is our Deputy Speaker, Bernadette Herrera.
Yeah, thank you, Madam Chair. Well, actually, very short questions lang naman. I'd like to ask lang regarding the health information system. Ano na po ang status nito? Madam Chair?
Good morning, Madam Chair. This is Dr. Art Alcantara
Yes.
po, acting CIO po of PhilHealth, no. Currently po, no, we are upgrading our systems, no. Like yung mga network natin, we have to improve kasi minsan nagbabottleneck because of the increased volume of claims na nare-receive ng PhilHealth ngayon, no, especially now na may COVID, no. And we are also upgrading po yung other resources po, like for example, yung mga storage natin, para po mas madali po makapag-submit po yung ating mga providers, yung mga facilities natin, and hindi po naiipit yung mga submission nila doon sa PhilHealth na medyo masikip nga po, no, yung aming mga resources. Aside from that po, we are also beefing up po yung internal systems namin, no. Like for example po, we are getting po yung mga integrated systems po para po integrated and connected po lahat po ng mga processes natin within PhilHealth po para po mas mabilis po yung pag-transfer po ng mga information at yung other na activities po na kailangan po na mapabilis po yung processing ng claims. Yun lang po.
Madam Chair, My question relates to Section 36 of the Universal Healthcare Law, wherein all healthcare providers and insurers shall each maintain a health information system. So I want to know, ilan na ba sa mga health service providers natin and insurers ang naka-enroll dito, or meron na tayong may sarili na? Kasi supposed to be DOH and PhilHealth will be the one to create this and develop and fund this. Ano na ang status nito? I didn't get an answer to that because that is very important. Kaya tayo nagkakaroon ng gulo sa mga fraudulent transactions kasi hindi tayo computerized. And this is part of our healthcare, universal healthcare law. Anong status na nito? Ilang percent ng our hospitals are actually enrolled to this?
Actually, currently at the SBH, the healthcare providers, the private hospital has to get a third-party provider. So, majority, I think, I don't know lang how many, probably Dr. Almora can answer that. But for DOH retained hospitals, I think it is provided by the DOH. No, that's the question I raised. I think last hearing, last week Tuesday, kay Doc Art, na meron na bang ready na system kayo to be shared sa ating lahat ng healthcare providers? Kung Doc Art, if you can answer DSBH.
Yes po, if I may po, no, Madam Chair, no. Actually po, yung since noong 2017 po, we have implemented po yung electronic claims namin. So ibig sabihin po, yung mga nagsasubmit po ng claims sa PhilHealth ay meron na po silang health information system. So either po meron silang sariling system or they get the services of a service provider, an IT service provider for them to be able to submit yung claims po sa PhilHealth. So ibig sabihin po, right now po, 100% na po yung mga facilities namin na nagsasubmit po ng claims sa PhilHealth ay may HIS na po. So, yes po.
Doc Art, but this HIS is a third-party provider or system developed by the facility, not coming from you.
Yes po. Yes
Yeah.
po. And yes po, yung natitira na lang po is yung other facilities na lang po, like for example po, yung mga bago po, like yung mga testing facilities po, yung iba po wala pa pong capability, no? Kaya po nahihirapan mag-submit po ng mga claims yung mga testing facility. Kaya po nagsasubmit po sila manually ng mga results po nila sa PhilHealth para po makapag-claim. Yun lang po.
Madam Chair, my question is, nag-develop ba ang DOH and PhilHealth ng sarili nating information system? Because that's the one that's required of the law.
Doc Art and DOH. Anyone from DOH? Anyone? May currently na po ba? Yes or no lang po ang answer.
Mr. Chairman, Madam Chairman, kindly recognize Director Eric Tayag of KMITS DOH.
Director Eric? Doc Eric Tayag or anyone from PhilHealth? Answer lang po. Do you have a system right now being developed for our facilities based on the provision in UHC?
Well, sa amin po, no, for PhilHealth po, no, in terms of yung e-claims po, hindi po kami nag-develop ng system kasi po marami pong yung mga kanya-kanya mga facilities po, they develop their own. Kaya mahirap po mag-provide po ng system for them, no. Kaya nagbibigay lang po kami ng standards. Pero po for the consulta, we have already developed an e-consulta po for the yung mga consulta providers para po ma-implement po yung e-consulta natin. Yun lang po.
Madam Chair, may I ask if they have read Section 36? Kasi medyo very specific yung Section 36 natin and medyo matagal na tong Universal Healthcare Law. And I don't know why I can't get a specific answer with regards to this one. And I can't find it in the IRR also, Madam Chair. That's why interested akong malaman, are we setting aside funds for this? Because naalala ko dun sa mga previous PhilHealth hearings natin, merong budget na sineset aside for computerization. And since this is part of the Section 36 of our UHC, anong status na nito? Are we violating our own law? Because kung sinasabi natin, we are just using na lang what the others are using, then we have to amend this law kung hindi na natin gagawin ito. Anong bang direksyon natin?
Okay,
May
answer. Thank you,
come up
DS.
with that.
Can
Yes,
we
ma'am.
get a direct answer from DOH? Yes,
Yes,
Sir.
USEC Mar to give his rejoinder. Thank you.
Yes, Madam Chair. Yeah, I will give some reply, but I think the details we can submit because we cannot contact Director Eric Tayag. But right now po, mayroon talagang mga na-develop ng health information system ang Department of Health when it comes to our mga health centers and clinics. Ito po yung iClinicsys. And then we mayroon po sa hospital system din yung iHomies. But we are right now working with PhilHealth kasi mayroon ding mga data needs ang PhilHealth when it comes to the enrollment, registration, and so on. Ang inaayos po ngayon is yung interoperability nitong system na to para yung mga necessary information na kailangan ng Department of Health ay ma-access din ng DOH from PhilHealth and vice versa po. Yung kailangan naman na information ng PhilHealth na manggagaling sa DOH ay ma-access din ng PhilHealth. So para po
Madam Chair,
yun ang wino-work ngayon, yung
Madam Chair,
interoperability system.
I think DS BH, the answer is currently no. Wala pa silang system.
Exactly.
Na develop.
Yes, Madam Chair, ang tanong ko na lang, does DOH or PhilHealth have the capability to do it? Kasi ilang years na, but they're not doing it. And since PhilHealth sila, hindi naman sila expert on this, DOH sila, hindi sila expert on this, should we tap another department to do this? Like DICT perhaps? Because otherwise, hindi nakaka-focus eh. So I'd like to know, do you have the capability to do it? Kasi ilang years na, but up to now, the answer is still no.
Okay, Yusek Mario and Doc
Do you,
Art.
Madam Chair?
Yusek Mario
Yeah.
and Doc Art.
Yeah, Madam Chair, before PhilHealth po, actually, as far as I know, mayroon na pong coordination with the ICT. No? Ito po yung para maiayos yung system ng both DOH and I think PhilHealth para mayroong harmonized system for interoperability. But right now po, mayroong sariling information system ang Department of Health, which I have described earlier in its broad term. Pero inaayos po ngayon with the ICT para mas harmonize yung system. So yun po ang major link namin sa ngayon.
Okay, PhilHealth. Can we hear from PhilHealth, Doc Art? Do you have that capability?
Well, admittedly, no, medyo may kakulangan po for the capability, no. So currently po we're coordinating po with the ICT with regards to resources and then yung expertise din po for the development of the system. Yun lang po.
Dagdag ko lang, Madam Chair. Dagdag ko lang, Madam Chair. I was just fed this information now. Yung DOH Integrated Health Information System, which shall be made available at no cost po ito, no, to healthcare providers and insurers that have no capacity to develop and implement their own. And this is an ongoing system development by the Knowledge Management Information Technology Service for phase 1. Yung clinical modules constitute the phase 1. So I think Director Eric, if he's already on board, can give the more detailed explanation as to the status of this development. Pero meron, the answer is yes. It's being developed, okay. Madam Chair.
Okay, thank you.
Yes, Madam Chair. Madam Chair, baka pwedeng i-request na mag-submit sa atin kung anong status and how much funding has been set aside to in order para lang makita natin yung totoong picture because yung connectivity is very important to avoid fraudulent transactions. Transparency and pag-computerize tayo, that's why we put it in the Universal Healthcare Law. And it should be a priority. And I hope that PhilHealth and DOH actually takes this seriously na very important ito. So I hope that DOH and PhilHealth can submit to this committee through you, Madam Chair, kung ano yung status talaga, and then maybe invite the ICT also. Maybe we can have a separate hearing on this, Madam Chair, because it's a serious concern. Like you said, it was your concern also. Baka pwede through you, we can set a hearing just to see the information system, na preparations ng DICT, DOH, and PhilHealth.
Okay,
Permission to speak,
thank
Chair.
you. Yes, brief explanation.
Okay.
Director Eric.
May dalawa tayong health information system sa primary care facilities, iClinic SIS po, parehong electronic medical records po. Sa mga hospital facilities po, iHomies, we plan to integrate this. And this is also network with the PhilHealth para sa kanilang reimbursement. Sa primary care facilities po, 80% na ang functional po sa health information system na ginagamit yung iClinic SIS. At sa mga ospital, Madam Chair, 80% sa public hospitals. Yung ibang private hospitals gumagamit ng ibang application at vina-validate po namin yon para there will be no fraud. At kaya lang po, sa Universal Healthcare Act, dapat lahat po ng electronic medical record system ay manggagaling po sa PhilHealth at DOH. Sa ngayon po, may ongoing kaming consultation kung paano ipatutupad po kasi yung ibang ospital po na babalitaan namin, nagbabayad po sa mga third-party applications. Sa Universal Healthcare Act, dapat walang binabayad at ang Kagwaran ng Kalusugan at PhilHealth ang siyang dapat nagbibigay po niyan. Kami po ay nakikipag-ugnayan sa DICT kasi na-map out po namin ang mga lugar, facility na walang magandang infrastructure connectivity para sila po ay hindi na magkaproblema. Maraming salamat po, Madam Chair.
Thank you, Director Eric.
Madam Chair, just to inform you that the Committee on ICT has hearing on August 27 with related matters tungkol ho dito. Just to share to the body. Yeah.
Thank you, DS.
Ayan.
Okay.
Yes. Madam Chair,
SPH.
Madam Chair, sorry. If mayroong hearing si Kong West, may I request the ICT, DOH, and PhilHealth to be ready para mag-present sa committee ni Kong West, sa committee on the ICT.
Yeah, with
kay Vic Yap. Regarding this matter, kasi parang nag-iisip din kami kung paano gano'n ng e-health bill eh. So baka it's high time that we fix the situation already para lahat ng hospitals natin link up to avoid fraudulent transactions.
Just wanna...
that's all, Madam Chair.
The SBH, we passed already the e-health bill.
Okay, thank you.
We were with Director Eric Tayag in crafting that electronic health bill, no? But yung HIS kasi another system siguro siya for the operation of hospital and yung interoperability between the hospitals and the DOH and other agencies, especially the PhilHealth. Thank you, the SBH.
Yes, Madam Chair, sana by the time the committee on the ICT discusses this, ready na rin si PhilHealth and si DOH to present para hindi na tayo babalik sa Committee on Health kung nandoon naman na sa Committee on ICT.
Okay, thank you so much. Kindly for your gadgets or
ay, nako.
kindly mute.
Ay, kasi mo na, yung ganito nyo.
Magpantay.
Yung button.
DOH, Director magpantay, kindly mute.
Mute, please.
Irinig po namin kayo.
Madam Chair,
yes po.
yeah, I'm not sure if Chairman Vic Yap is online with us now, but if not, I'll inform him to also try to invite DOH and PhilHealth because the hearing on August 27 is purely DICT, but it's related to all their COVID-19 response and preparations and actually connected ho sa pinag-uusapan natin. Thank you, Madam Chair.
Madam Chair, permission to speak?
Yes, Director Eric.
Okay, nagpapasalamat po kami at sana matuloy-tuloy na po yung e-health bill maging batas. Kasama po rin yung Integrated Health Information System. Maraming salamat po at kami po ay sasama po sa invitasyon sa August 27 para makapagbigay po ng mga rekomendasyon at makinig din po kung ano po ang mga hakbangin sa mga susunod na buwan o taon. Maraming salamat, Madam Chair.
Thank you, Director Tayag. Okay, so much for this agenda on UHC implementation. We'll now proceed to the next agenda, which is, I think, ito na yung hinihintay ng ating mga kasama, which is the issue on the circular that was issued by PhilHealth last August 13. Before I call on PhilHealth for their presentation, I just want to walk you through what prompted this committee to call for the hearing on this circular. On August 13, 2021, PhilHealth issued PhilHealth Circular number 2021-0013 with the subject Temporary Suspension of Payment Claims or TSPC. The rationale of this circular is to prevent the continual loss or wastage of public funds due to indiscriminate or irregular use of the National Health Insurance Fund by imposing the temporary suspension of payment of claims against accredited healthcare providers at the onset of the investigation, pursuant to their duty to assure rational use of funds by detecting potential fraud or reimbursement abuse through dubious claims. We understand that this power to issue a suspension order is granted by the National Health Insurance Act of 2013 under Section 17, Quasi-Judicial Powers, letter C, which reads, subject to the respondent's right to due process to suspend temporarily, revoke permanently, or restore the accreditation of a healthcare provider or the right to benefits of a member and or impose fines. The decision shall immediately be executory, even pending appeal, when the public interest so requires and as may be provided for in the implementing rules and regulations. Suspension of accreditation shall not exceed 6 months, and suspension of the rights of members shall not exceed 6 months. The revocation of healthcare providers' accreditation shall operate to disqualify him obtaining another accreditation in his own name, under a different name, or through another person, whether natural or juridical. The corporation shall not be bound by technical rules of evidence. Pursuant to this power granted by law, PhilHealth issued on August 17, 2016, Healthcare Provider Assessment System or HCP PAS Revision 1, which initially instituted the guidelines for investigation, monitoring, and suspension of benefits and accreditation, which was amended by PhilHealth Circular 2018 to 2019, or HCP PAS Revision 2, dated December 12, 2018, letter H of that PhilHealth Circular, provided that in case of apparent and probable presence of irregularities and or abuses of National Health Insurance Program, the corporation may issue temporary suspension of payment of claims for healthcare providers with pending further evaluation, verification of the monitoring findings subject to the following conditions. Number 1, temporary suspension shall be effective upon receipt by the healthcare provider of the notice of suspension. Number 2, the temporary suspension shall apply to specific claims already in possession of the corporation and the payment has not been released, including those still for submission after the effectivity of the temporary suspension payment. Number 3, all benefit claims subject to further verification shall no longer fall within the usual 60 days processing period. And number 4, if a healthcare professional is involved, specific claims in all his or her affiliated healthcare institutions shall likewise be subject to temporary suspension. Number 5, the healthcare provider shall continue to provide PhilHealth benefit to qualified beneficiaries for the entire duration of the said suspension order. Number 6, the concerned healthcare providers shall be given feedback on all validated reports within 10 calendar days from completion of validation. And in case of adverse monitoring findings, the HCP shall submit an explanation or justification within 10 working days from the receipt of feedback from PhilHealth. And number 7, upon establishment that patterns of abuse and other monitoring issues that warranted the suspension order are no longer present, the order of temporary suspension shall be lifted accordingly. Number 8, the suspension shall not exceed 120 days or 120 calendar days. Number 9, upon determination of the presence of or existence of irregularities and or abuse, the concerned PhilHealth Regional Office may similarly opt to deny payment of claims in lieu of a suspension order. HCPs may file an appeal on the denial of claims within 60 calendar days to the PRO from the receipt of the written notice of denial of payment of benefit claims. And lastly, HCPs with adverse monitoring findings and serve a suspension of payment of claims shall be subject to probationary accreditation for 6 months. In case the remaining accreditation period is less than 6 months, the probationary accreditation shall extend to the next accreditation period. Now, here comes PhilHealth Circular number 2021-0013, issued on August 20, 2021, amending letter H of PhilHealth Circular 2018 to 2019 or 2018-0019. And notable to these amendments are, okay, if I may cite there. Number 1, the issuance of notice of findings to the HCP and the filing of an answer within a non-extendable period of 3 calendar days as opposed to the previous 10 calendar days, which shall commence upon the receipt of the validated feedback from PhilHealth. Number 2, if the answer of the notice of findings lack merit or no answer has been filed within the prescribed period, the TSPC order shall be recommended in the investigation report. Number 3, a notice of TSPC order shall be issued by the VP or RVP to the HCP indicating the effectivity date, which corresponds to the date of the investigation report. And number 4, the notice of TSPC order shall be delivered to the concerned HCP through available communication channels such as email, short messages, private courier, and personal service. And the coverage of TSPC order which may include letter A, all affected and identified claims already in the possession of PhilHealth that have not been paid, including those refiled under motion for reconsideration and or appeal. And letter B, affected or identified claims that will be submitted to PhilHealth after issuance of the TSPC, but before the lifting of the TSPC. And the extent of the TSPC, which can either be all claims of the concerned healthcare provider when the findings can extend to other claims, like for example, suspected claims for a non-admitted or non-treated patients like ghost patient can involve any claim. And letter B, all claims of a specific condition or procedure when the findings are particular or exclusive to such condition or procedure. An example which is the sweeping of patients for cataract extraction. TSPC shall apply only to cataract claims of concerned HCP. So now the healthcare institutions are of the opinion that the circular aims to suspend temporarily the payment of claim on the ground of apparent or probable cause or on the mere suspicion and sees it as another ploy of PhilHealth to deny or delay payment of claims. healthcare institutions are already contemplating to review its engagement with PhilHealth, which will have serious repercussions on the implementation of the universal healthcare. So would like today we have, I think, representatives from Philippine Hospital Associations, Private Hospital Associations of the Philippines, and Philippine Medical Associations. But we would like to hear first from the President of PhilHealth, Attorney Dante Garan, to shed us on the matter, no? Attorney Garan.
Thank you again, Madam Chair. First of all, we would like to assure this committee that those requested documents by the Madam Kong Stella and Madam Kong Herrera will be immediately submitted by us. Thank you po. Now, thank you for allowing us to clarify the rising issue surrounding the recently released PhilHealth Circular number 2021-0013 entitled Temporary Suspension Payment of Claims, or what we call the TSPC, that was published on August 20, 2021 in the Manila Times. Your Honors, the TSPC was already in effect since 2016, embodied in PhilHealth Circular number 2016-0026 and PhilHealth Circular number 2018-0019, or the Healthcare Provider Performance Assessment System, commonly known as HCP-PAS, alongside PhilHealth's mandate to ensure financial risk protection of its members, is its fiduciary responsibility to protect the National Health Insurance Fund. Likewise, strengthening fraud control in support of these administrations and Congress directives. Let us be clear that this policy does not intend to further burden our partner stakeholders, especially during this pandemic. On the contrary, provisions in this policy strengthens due process by, number one, giving the HCP the opportunity to answer the notice of finding issued to it by the RBPs, or the Fact-Finding Investigation and Enforcement Department, and two, transferring the approval of the TSPC to the President of the corporation, effectively ensuring that processing of fraudulent claims shall not be arbitrarily stopped. Likewise, this policy do not affect the current strategies of PhilHealth in fast-tracking the processing of claims nor the debit-credit payment method in ensuring the unimpaired delivery of healthcare services. We would like to assure you, Your Honors, our members and our partner accredited healthcare providers, that due process shall always be observed, and those who are not in the business of fraud should not be concerned. Sa totoo lang po, Madam Chair, nag-usap na kami kahapon ng mga hospitals, no? Brokered by Dr. Yusik Vega, and as a matter of fact, in attendance was Dr. Almora. And maganda na po usapan, at saka siya na lang po ang sasabi ko anong sasabihin niya mamaya. No? Muli, magandang umaga sa ating lahat. Maraming salamat po. God bless us all.
Thank you,
And
Attorney